CNN's Sam Kiley is live in Delhi. We want to warn you, a lot of what you're going to see here is disturbing. Sam, why don't you walk us through what you're seeing?
So, John, I'm in the Simapuri cemetery in Delhi. This is one of a handful of cemeteries that are working almost round the clock. I'll just get out of the way. Let's move the cameraman out of the way. This is wood supplies. We've had about 6 of these go past us in about the last 20 minutes as they are carrying wood to the pyre. As you can see, many of the dead here are waiting to be buried. This location is just one in Delhi, John, and they're burning about 150 people a day, often late into the night in contravention of Hindu tradition, when these rites are usually performed during the day. They've had to call in for extra supplies of wood because the death toll here is completely beyond anything they've been led to expect to be able to cope with. These are all the remains of human beings who've been unable to be properly mourned by their families and friends, who've been taken mostly, almost entirely, we're told, victims of the COVID pandemic that is rapidly coming to the stage of representing something that is almost biblical in scale here in Delhi, because the figures of officially some 600 dead, extra dead a day in Delhi. But this is a sign of just how bad things have become, John. This is an addition to the crematorium. None of this existed before last week. It was all used as an extension so that people could get through the numbers of people who are passing away in as hygienic a way as they possibly can. There's another person coming through just now, yet another example, a result of Narendra Modi's government here, who earlier in the year, amazingly, seemed to indicate that they thought that India had reached a level of herd immunity. They've been conducting political rallies all over the country, allowing massive Hindu festivals on the river Ganges, all of these super spreader events contributing to scenes like this. Quite terrifying. And this is by no means, John, the only crematorium in the city, and similar scale of problems have been seen in Maharashtra state, in in a lot of the other states around India, where also the vaccination program has been halting. In Maharashtra state, they just announced yesterday that that the vaccinations of planned for 800,000 a day had to go down to 200,000 a day because they simply weren't being supplied enough of the vaccines, John.
Sam, I don't know what to say. What you're showing us is heartbreaking, and it's overwhelming, frankly. Everywhere your camera turns, we are seeing death at this point. It's difficult, I think, for us here in the United States to get a real grip on the scope of the devastation that you're seeing there. Has this just completely overwhelmed daily life in India? Is it now everywhere you turn?
Well, amazingly, there are areas of the country where the levels of infection are lower, and as a proportion of population, if the official statistics are to be believed, and frankly, I for one don't believe them, then India is well below the sorts of levels of infection that we're seeing in the United Kingdom, the United States, right across Europe. But this rather tells a different tale, doesn't it? It is true to be said, though, John, that the public health system is being overwhelmed. We have seen hospitals here running out of oxygen, running out of hospital beds. The incapability of the central government to provide enough oxygen has led to the United States to give $100 million worth of donations. The United Kingdom was first to send out extra oxygen and the capacity to produce oxygen. Lots of other countries are contributing, but this, of course, is a nation that is a net exporter of the coronavirus vaccine. And the question, of course, for the Modi government is, why did you send it abroad when it was needed at home? The answer to that is both commercial and political. He was genuinely of the view that India seemed to have somehow weathered the pandemic storm without a massive vaccination program. So that is due to get underway at the beginning of May. There are over 4 people that tried to register for vaccinations just yesterday, we understand. So there is a desperation. There is not quite the capacity, but there is an understanding finally in India that vaccinations are the way forward. But for those who've missed out, who've been attending these super spreader events, been contacted by others who've been infected at these super spreader events, then the result is not always death, but it is profoundly deep sickness and illness. And it is the ill people, of course, who are so desperately being kept alive. They are going to be saved, a lot of them, by these donations from the international community. But it'd be very interesting to see whether or not there's political fallout for the central government here, who by any standards have failed to meet the basic needs of a country which is mired in poverty, but also has a space program. John?
Sam Kiley, to you and your team, we thank you very much. I know this is hard to be in the midst of. I know this is hard for you to walk around and see all this death. We appreciate you showing us. The world needs to see what's happening there. Thank you very much.